So I was actually doing a PhD in economics in Barcelona, and then my father got sick. And so I came back to the US to spend some time with him, and he was in and out of the hospital. And he had a digital health company that he had started several years ago. And they had focused on supporting folks with diabetes and cardiovascular disease and hypertension. And my father himself had diabetes and had suffered through that a lot. So they had focused on that and focused originally on working with self-insured employers, with payer groups. And so I came back, in addition to my father being in the hospital, I got a chance to really sit down with him and figure out what's going on with the company. And the reality is that market had really gotten hit hard in COVID. They had lost 80% of their revenue overnight, literally, with the pandemic. And so we sat down and spent about a year and a half thinking about how to rebuild the team, rebuild the technology, and actually pursue a new market and a new vision where we're really focused on supporting physicians with value-based care now. So we saw a new opportunity there. But yeah, really entirely driven by my family. At a fundamental level, what we do is we help patients do what their doctor told them to do. And that's one of those things that it isn't easy. It isn't easy to do what your doctor told you to do. It's actually really difficult. And for doctors, it isn't easy to get patients to follow the instructions. And so that's our job. That's our specialty. So we collaborate with those doctors, with physicians, with medical groups, outpatient groups. So think your primary care doctor, but also with hospitals. And to help patients after they get released from the hospital, after they get discharged, we're there to help them in that period after follow all the instructions that they got out of the hospital and make those changes to make sure that they stay safe and they recover. And the same thing for folks with chronic conditions. We work with their primary care doctor, say, great, you got diagnosed with diabetes, you have to make all these changes to your life. We're the ones that are going to help you do that. And so we do that with evidence-based practices to help you change your behavior, but also with devices. We're providing glucometers, blood pressure cuffs, these devices so that we can help track your biometrics as well and support you along that journey. We're not replacing the clinical knowledge of the doctors and the nurses. We're supporting with behavioral change knowledge that is really necessary. And we're able to do that in a way with technology to do it remotely, which is difficult for medical groups to build themselves. The market is huge. So when we talk about our massive growth potential, all of this, we're still only serving a fraction of the market, right?
Are you national or in certain states, or how is it structured?
Yeah, so we go state by state because we are billing insurance, but we're in 12 states now, all across the country, from Washington, D.C. to Washington State to Texas to Illinois. So we're across the country, but we roll out state by state.